Verbal reports. There are times when you will need to pass on important information to members of the home health team by giving a verbal report. Before giving report, write down all the relevant information so it will be organized and nothing will be forgotten. You might give a report to your immediate supervisor about immediate client concerns, other home health aides involved in your patient's care, or therapists or physicians with information about patient recovery and improvement. It's very important when sharing information about your patients that you make sure to protect your patient's privacy and confidentiality. Only share information with members of the home health team, family members who have been authorized by the patient, and the patient's own physicians or specialists. Never share information with anyone without permission from your patient. Confidentiality will be covered in more detail later in the course. Sometimes your supervisor or another member of the home health team will want to give you a brief oral report on one of your patients. It's important that you listen carefully and take notes so nothing is forgotten. Make sure to ask questions if you don't understand. At the end of the conversation, restate what you've been told to make sure you receive the correct information. Verbal reports follow the same expectations as written reports. Even though it's not written down, it will still be remembered and recorded in the same way. Verbal reports should always be professional, be brief, accurate, relevant. Don't include any slang or gossip, and be respectful of the patient and the person you're reporting to. There are two reasons to report your patient status. One is to report information that your supervisor needs to know about immediately. The other is to discuss with other members of the home healthcare team about your experiences with the patient and the family members. This would be a good time to include some tips and tricks for how to communicate or how to deal with a certain behavioral problem. Your patient's condition, what kind of diagnoses are relevant for their care. Some important aspects of the patient's care include allergies or include any tolerances to any foods. Also, could include likes and dislikes of the client. Be sure to also document this information in written form, particularly if the information is about a change in the patient's condition. Examples of information that should be immediately reported are any falls or increase in falls, any chest pain, severe headaches, difficulty breathing, any abnormal pulse, respiration, or blood pressure, a change in the client's mental status or a loss of consciousness, sudden weakness or loss of mobility, even if it's not significant, a high fever, any bleeding that is not able to be controlled, any bruises, abrasions, or other possible signs of abuse. Sometimes you may have to give a verbal report over the phone. Whenever possible, talk to the person directly. Do not leave information in a message. Telephone reports should be professional, brief, accurate, and documented in written form as well. Sometimes you may not be able to reach the person you wish to give report to and must leave a message. Ensure that you do not leave any sensitive information on the message to maintain confidentiality, and make sure the important information is received by the right person. When leaving a message, leave your name, position, and number to return the call. Ask for a callback concerning a client. Do not give the client's name. Document that you left a message.